Westwood, your host, and I'm so glad you could join us this evening. We have a very special show, very special woman tonight. Her name is Dr. Jewel Pookrum, and I know that she's a household name wherever you happen to be. But before we get into our guests and we begin the show, I'd like to first thank our sponsors, TamsHealthyKitchen.com, thetonfoundation.org, and newbodyproducts.com. All of these can be found on the home page, and if not, very, very soon they will be. We have a very new sponsor, which is our New Body Products line, and I invite you to connect with each one of these and check out these websites so that you can find out a little bit more about each one of our sponsors. Without these sponsors, we wouldn't be able to bring you this vital information. And as usual here on Solutions Radio, we are here all about the solutions. Certainly we all know what the problems are, but it's time to become proactive as a people, to unite and to bring, first of all, health. Because if you're not well, if you're not feeling healthy and vital, then you can't very well do very much in the world. So to talk a little bit about our show tonight, we have, as I said, a very special guest, Dr. Jewel Pookrum. She's the medical director and founder of Perfect Health Institute of Nutritional Science, which is a health environment where clinical medicine and holistic practices are combined in a highly individualized approach. Her treatments have helped patients to heal visible signs of cancer, erase aging lines, and learn to live happily. They're learning to be balanced and pain-free. Now, according to Dr. Pookrum, nothing in our world has the power to make us weak, sad, or diseased if we opt the proper attitude, the diet, and the commitment to wellness. Each of us can live in infinite perfection. Dr. Pookrum's holistic philosophy incorporates her gynecological training and a 10-year odyssey into the holistic wellness therapies and techniques. The capacity for health lies within the human body. The body is a barometer for assessing one's ability to live in harmony with his or her own environment. Wonderful. I'm so excited to have Dr. Pookrum. She's very near and dear to my heart. I've gotten to get to know her quite well of late, and she's a very powerful light on the planet. So I'm going to share her with you. For those of you who may not be familiar with her, meet Dr. Jewel Pookrum. Welcome to the show, Dr. Pookrum. How are you?
Oh, greetings. How do you want me to call you, Tamara or Miss Westwood?
Tamara is perfect. We're that close.
Okay.
Please call me Tamara.
Thank you.
Well, I just want to begin with, because there may be some people who are not familiar with you. I'm a little surprised if anyone is not familiar with you, but just in case, I'd love for you to share a bit about your background and what brought you on this path.
Oh, boy. Okay. I'll try to make that as brief as possible. I have been interested in the human body most of my life. You know, I've had a microscope since I was 8 years old, and, I remember one event that I had declared when I was 5 years old that I was going to be a doctor. And I really had kind of forgotten about that. I had gotten very interested in the things that most people couldn't see. And having a microscope since I was 8 years old, I had decided that I really wanted to go into research. So I graduated from college with a major in zoology and a minor in biochemistry. And from there, I decided I wanted to go into electron microscopy because I even wanted to see things that were even smaller than what could be seen with the average microscope. And in the process of completing the classwork for a master's, I was invited literally to go to med school. Now, I didn't really take that invitation too seriously, nor was I real happy about it, because I was very serious about getting my graduate degree in electron microscopy and virology. However, the way things worked out is that, the applications were literally brought to me. I filled them out of respect of my graduate counselor. The details are taken care of as they are by the universe. And, the next thing I know, I was invited to just appear to the dean of students to these medical schools. So I did that, and in the process I was waiting for my acceptance letter from the University of Wisconsin's electron microscopy and microbiological research department, and it just never came. So I decided that, I didn't want to miss a semester. So I said, okay, I'll go to med school, and as soon as my letter comes, then I'll just skip along and finish up my graduate work. Well, in the process of recognizing that that was literally a sign and a calling to the commitment that I had made when I was 5 years old, even though I forgot about it, it turned out to be an incredible journey, to the extent that I was interested in becoming a neurosurgeon, and during the time that I was in medical school, they really were still kind of fumbling around with understanding the brain, and the neurosurgeons that I had the opportunity to be exposed to were kind of like living morticians to me. It's like everything they touched, there was some type of residual. Either the person was going to be in a coma, or they were going to have some type of paralysis or paresis or some type of sensory loss. Is it, blurred vision the rest of their life, or loss of hearing? And I just said, well, I don't think I could deliver that message every day. So I'm like, I think I better find something that, I can get a little more precise results from. So I did all my surgical rotations, and gynecology was the most, I think, traumatic. And I was just very surprised that obviously it was a male-dominated surgical profession.
Really?
I was very surprised. Oh, yeah, most GYN has always been run by men. So a lot of the things that have been designed for women to do were not necessarily in their best interest. It was just to be made comfortable, for example, for the men to deliver the babies. Like most women can tell you, to lay on your back and have to push the baby out is not the ideal position you'd like to be in. So, very much so. But, that was literally for the benefit of men, as opposed to, creating tables now that we have that put the mother in an upright position where she can, squat and bend and everything like that. That wasn't even thought about. So with more women going into obstetrics and gynecology, it became much more supportive of women, even though the whole specialty was centered around her. So my dismay, I won't trouble our audience here, but I saw a lot of things that really were quite uncomfortable for me, and I felt that the level of compassion and concern was not there. I just have to be frank, and I recognized that if changes were going to be made, they could only be made in my office. I could not demand for somebody else to, change their ways. I could take control in my office. And in the process of doing that, because like I told you, I wanted to originally be a neurosurgeon, that took me into obstetrics and gynecology. And so now this is very important, Tamara, to recognize that just 25 years ago, a young obstetrician gynecologist would literally have a full gynecologic practice. Now, before that time, that was really unheard of. Normally you had to deliver babies for 20 years, and then with the mothers who finally begin to have GYN problems, would you then develop a GYN practice. But for a young person to be able to go straight into GYN really said something about the significant and very rapid decline of the women. And even to this day, Tamara, that is not discussed, and I'm very concerned about that. So I spent a lot of time really trying to understand what was really happening with us, especially being the gateway to this dimension. No man or woman gets here unless they come through the woman, that she was actually declining so rapidly. A lot of the birth defects that I saw, a lot of the problems that I observed with premature deliveries, with, fetal distress syndrome and lung diseases that initiated at the time of birth were just really information that was not given to the mother. For example, just something very simple. I know for a fact that women who do not do heavy lifting and who do not raise their arms to pull something down after 20 weeks of pregnancy rarely deliver babies with cords around the neck.
Okay, and
so, and nobody tells the mother that.
But this is something that Grandma told us.
Well, right. Nobody tells mothers that. So, therefore, they're just climbing up and reaching and pulling down and whatever else. And then, you know, from an obstetrical perspective, I mean, that is something that really the obstetrician has to be alert on, because once the waters break, the head crowns, and that baby comes out and you can see that that face is looking a little puffy. And then the first thing you do when you actually begin to deliver that shoulder and you see that cord wrapped around that neck, it's like, okay, you know you've got to get busy, because if you do not deliver this cord properly, et cetera, then if that baby then now takes a breath because those shoulders are delivered, then you've got problems here, and especially if the amniotic fluid is what they call meconium stained. Now, for my listeners out there who may not know what that means that there's been some type of stress that the fetus has experienced that has caused the baby to have a bowel movement in its amniotic fluid, okay? And therefore, now the bile that is made by the liver, stored in the gallbladder, emptied into the intestines, passes out into the amniotic fluid, and it stains it. It makes it a golden yellowish brown. Bile, as you know, just like if you know, belch and bile is sitting there in the duodenum and it comes up through the stomach, up through the esophagus, it's very uncomfortable. It burns. It's quite acid, very, very alkaline. And so, therefore, you can imagine what it's going to do to new baby skin. That's why the skin, they're usually born with, you know, like they've been peeling or slight ulceration. And it just will totally destroy lung tissue if the baby inhales that amniotic fluid into its lungs. And, of course, the babies always swallow the amniotic fluid. That's how the amniotic fluid stays in control, stays a certain volume. So what is normally the trauma that usually stresses the baby? And it's because of that cord being wrapped around the neck. It's rare that you will deliver a baby that has amniotic stained fluid and the cord is not around the neck. But who told the mother you cannot lift anything basically higher than your waist? Because otherwise that uterus becomes very vertical. And then the cord then automatically has no choice but to actually fall and wrap around the baby.
Right.
But mothers are not taught these things. So I'm just saying that, you know, a lot of problems like this where it just was not looked at, the mechanisms of what goes on and how can we explain this to a mother so that she could circumvent problems, just was not done. So,
and that's something that's very simple. It's very simple to avoid all of that. That's amazing.
So I spent a lot of time, teaching, more so than doing surgery, and I finally got to the point to recognize that I was just really not happy in believing, for example, that uterine fibroids could only be cured with a hysterectomy. And even to this, I mean, can you imagine, we have space stations in outer space, we are going to other planets, and you want me to consider and to accept that uterine fibroid disease can only be cured by sterilizing the woman? I just refuse to accept that. And I just said that if that's the treatment, that being on the staff of a major hospital wants me to actually sell to my patients, I refuse to do it. Because, you know, there's no protocol, there's no coding, there's nothing to basically use diet, okay, to deal with states of consciousness, all these other modalities that directly affect the uterus. Now, listen, audience, this is very important. You know, many of my male colleagues used to always talk about hysteria in relationship to women with GYN disorders, or, you know, it was just all, you know, really emotional, and they just really kind of ignored a lot of the complaints that the mothers and the women would come in with. But when you open up the abdominal cavity and you actually fold back what we call the perineum, and you can, the peritoneum, you can actually see this huge cable of nerves that come out into the pelvis, and it actually looks like a horse's tail. It's storming here, so if you hear rumbling in the background, that's what that is.
Okay.
It's called the cauda equina, and the cauda equina is actually where now the spinal cord branches again and actually then begins to enshroud all of the organs in the pelvis and then begin to actually go down into the lower extremities of legs, thighs, legs, etc. When you look at that uterus, it is totally covered with nerves.
Oh, yeah.
We have to actually pull the nerves back when we do any type of surgery or manipulation on that uterus. You know, they're very fine nerves, but it's a whole network of nerves, almost like a second or third brain that the uterus is enshrouded in. Why am I telling you this? Because that means that every state of consciousness that the woman takes, the uterus is directly affected and is made directly aware of what you are thinking.
Yes, indeed. Wow.
So therefore, how in the world could anybody dismiss the direct correlation between what a woman is thinking, what is happening in her home, what's happening on her job, how she feels about herself as far as her self-esteem, etc. These things are directly affecting the reproductive organs directly. I mean, it's just like you're plugged in to a relay system of information, and to dismiss that when you can see the nerves totally cover the ovaries, the tubes, and the uterus is just, you know, a denial. And so, you know, I saw that in GYN, that a lot of the emotional complaints, the investigation into how she feels about herself, her relationships, what's happening with her family, none of that was ever investigated. It was like you come in, you get on the table, somebody examines you, they say, oh, yeah, take this cream, do this, do that, you know, take this pill, give you a shot, and you're out of here. And so it's like, well, when do we really discuss what's really happening here as far as attitude or emotional state? Because maybe that's why she's bleeding so. Yeah. Maybe that's why the periods are so heavy. Maybe that's why we can't control this. She doesn't need medication. We need to really look at what is being perceived in her brain that is being translated and transmitted to that uterus that can be addressed and supported. But that has not really happened until more women finally begin to come into the profession of GYN. So in that process, I felt, you know, taking out the uterus because we were having, you know, uncontrollable bleeding or whatever else, or pain, was not the panacea, especially when the woman comes back and tells you with no uterus that you took out that she's still in pain. I mean, you can't just continue to do this. You got to look at, you know, I did something serious. I took out an organ that I can't recreate. I took out an organ that I don't really understand how it all works, and the person is telling me they're still having symptoms.
Dr. Jewel,
yes.
Dr. Jewel, I just want to stop you for a moment. We have someone in the chat room who actually had a radical hysterectomy at the age of 17 because of scar tissue. And she's exiting now because this is bringing up some painful memories for her. Is there anything that you can say to soothe her?
Well, let's say this, that, you know, this was part of why I stopped doing surgery, because surgery was not the answer. Because obviously if she was 17 and we assume that, you know, this has been some years ago, that this lady still is not healed. Do you understand me? Right. So I'm saying that a person like this really needs to get some type of psychological support. And I do want you to understand that getting psychological support in no way insinuates that you are, you know, quote, crazy, unquote, or mentally unstable. What it means is that you have emotional chemistry. Every emotion is a chemical, that you have chemistry from the experiences that you've had that are still in the tissues that do not allow the tissues to function properly. And your capacity to be able to just discuss it with someone that listens and has an awareness of the mind-body relationship dilutes that chemistry out. Many people are almost healed or healed just from somebody professionally listening. And I say that this lady, first of all, needs to basically go and sit with someone professional and just tell her story. Yeah. That would make a big difference. And then from there, if she has made conclusions about herself or people in that experience, that it can be what we call reframed, that she can give them a different meaning, she can give them a different definition in her life, and that will totally free her from this discomfort. And that's what I do now. I mean, you know, I don't spend a lot of time now dealing with the physical manifestation of disease as I do with the attitude that created it. See, we need people that are professionals that can handle the attitudes that create this disease, and if you can do that, then what happens? If you can get a person to change their picture, to see it differently, what do? The first thing they do is that they change the chemistry of the blood, they change the chemistry of the tissues, and the symptoms change or literally go away.
That is so very possible. That is very powerful. And that would take me to the question of, okay, we have the mind and we have the brain. Certainly we want to differentiate the two. Some would think that they are the same thing. But I would like to, and I would like for you definitely to clear that up, but also speak about the emotions and go into the emotions and what their function is in all of this.
Okay. My headphones fell off here for a minute. Okay. Well, let's do that because that has been part of my concern. And as you know, with my Immortal Chat group,
yes,
this is the basic tenets that we deal with so that we can understand how to activate our immortal genes. Yes, it is true that we are immortal, that our tissues can live indefinitely, but they have to be supported by an attitude that is an immortal attitude. Yes. So let's look at this. It actually is the product of streams of consciousness and energy acting on the brain, which creates thought forms. And these thought forms are holographic segments or a neurosynaptic pattern, which is called memory. So your mind is actually a stream of an awareness that actually has images and pictures in it that the brain processes. So mind is not the same as the brain. That's why if the brain is damaged, the person's mind is not damaged, but the body, however, cannot respond to the mind without the brain being intact. You understand?
Yes. Mm-hmm.
So that is why that's very dangerous that we know now just to assume that just because a person is in a coma just to get busy wanting to pull the plug. Because we know that if that brain can be stimulated to heal over its injuries, that the mind then can again communicate to and through the brain. The brain will make the corresponding chemical components, which we call neuropeptides, and that will then tell the body what to do, and the body and the mind will become reconnected. And so for some people, that happens in 24 hours. They're in a coma. The next day, they're out. Some people, it takes 2 or 3 weeks. We've discovered some people, it takes 8-10 years.
Yeah.
But we know one thing is for sure, and this is incredible, and it's very important to remember. There is no tissue, Tamara, that cannot regenerate in the body. And I am so excited about that because when I was in med school, they used to talk about, oh, well, the brain, once you damage it, it just doesn't heal. And they used to say that about the heart, et cetera. And now we know for a fact all tissue, a capital A, capital LL, can regenerate. And what do we need to do? We need to create the environment for the tissue to do that. That is the only limitation.
Yes, indeed. Beautiful. I love that. And so we can look now at the cause of dis-ease in the body. And I didn't say disease, I said dis-ease.
Correct. Mm-hmm. Well, we know, for example, the emotions is very interesting. Now, let's be clear here because we have to understand the mind, body, or should I say mind, brain, body circuit.
Yes.
You are consciousness. You and your body are not the same. You are actual consciousness. And this consciousness now that has created a body, that's right, you create a body, has a mechanism that is an intermediary between you as consciousness or energy, because wherever there's consciousness, there is energy, and this vehicle known as the physical body.
Yes.
The brain is the mediator, and the communication tool for the body is chemistry. The body communicates through chemistry. So therefore, frequencies of energy, which are thoughts, permeate the brain, stimulate the brain cells to create corresponding analogous chemicals. Those are released into the bloodstream and through the nerves to the tissues. That's absorbed by the cells of the organs, and then they have their own library or nucleus, and then they will take action relative to the chemical information transmitted to them. Now, when there's a sensation that happens in the body, that sensation is a feedback mechanism that are chemicals that are sent out from the cell into the bloodstream. They go to the brain to let the brain know, yes, we got the message and we're taking action. Now, if you have an experience, okay, say, for example, somebody is immediately run over by a car in front of you, that will create a stimulation to the brain because you are seeing this happen. That will go in through your eyes and ears, etc. The brain will process it, release the appropriate chemicals. Those chemicals go into the bloodstream through the nerves, and then the tissues will absorb it. And based on what you are thinking, they will then take action.
Yes.
Now,
okay.
that sensation that is the feedback from that experience, you decide if that is going to be a trigger to take action or to actually go into a feeling. Okay, now it's very important because listen to me very carefully. What am I saying? One person sees the same accident and they immediately say, okay, someone call 911 immediately. Let me go and check and see if the person is breathing. Are they bleeding, whatever, and they immediately go into the situation as a support system.
That's
Another
right.
person standing there immediately turns and runs the opposite direction.
Yes, okay.
Another person standing there just screams to the top of their lungs. All they can do is just scream to the top of their lungs and holler, oh, my God, or, something, whatever. Now,
Right.
3 people can testify that the person got hit, run over by the car, etc. Why do we get 3 different responses? And that is because how a person thinks determines their reality. It determines what they're going to do. Now, the person who stands there and screams at the top of their lungs took that information into their brain. The brain made the corresponding chemicals to let the cells know this event is going on. And because that person has had fears in the past, which are stored in the cells, that's known as cellular memory, the cells immediately go into a response based on the past. Based on the past. And that is why, based on the past, and that's why this person is totally not functional and is now putting herself into a major stress phenomena because of her past. All emotions are from the past. Okay. If you stay in the moment, you will have a feeling, but it will mean nothing unless you then use it as a stimulus by what you're thinking. So therefore, the person who was standing there saw this happen. The cells responded with a feedback mechanism. We got the information. This person is injured. They immediately think, I need the help. And so that motivates them to immediately take control of the situation, monitor the person who's injured, and be able to give assistance. Okay? Fear was not there. You understand what I'm saying? The other person who was so terrified, their response to any change is to get away from it. And so, therefore, that's why they just totally went missing in action in this opportunity.
Fight or flight. They've decided to take the flight mode. Exactly.
Yeah. And the other lady individual who just screamed was totally debilitated. They couldn't even fight or flight. They just would now, just totally stuck there making noise.
It just froze.
And this is all because of how they've been thinking. So, simply said, an emotion is when you place a thought to a feeling. And so, therefore, you do not want to do that. You want to have whatever sensation go through the body. It's only chemistry. The cells will metabolize it. That will come to an end, and then the cells now are ready to begin to take action on what you want it to do.
So, Dr. Jewel, would you say that you have a moment, perhaps a brief moment in time, to decide what this feeling is going to mean for you?
Yeah, but it doesn't mean anything. It's a feedback mechanism to let the brain know, to let the body, to let the brain know that the body got the directions, and that's all it is.
So
if you give it a meaning, I beg your pardon?
Can you switch if it is your your natural way of moving into flight or into fear or whatever because of the past, can you consciously go in and say, no, I choose
of
not
course,
to
but
do
that's
that?
right, because
Mm-hmm.
your statement of naturally going into fear or flight, that's not natural. That's
Okay.
the whole point, okay? When a person has a healthy definition of who they are, change does not cause them to want to withdraw. The healthy person wants to understand what it is that's happening, and then from there, as a learning experience, will then learn what is the best mechanism based on their purpose.
Wonderful. Now, one moment here. I'm noticing that some people have just arrived. If you're wondering who this marvelous woman is here, we have Dr. Jewel Pookrum with us. She is the medical director and founder of the Perfect Health Institute of Natural Medicine. And she's also the moderator and the instructor for the Immortal Chat Club. And we're going to also get into that later and how you can take part in that. So please, let's continue on with emotions.
Right. Well, they're a very dangerous thing, okay? And let me just be clear here. A person who is in joy, a person who is, ecstatic and, exhilarated, those are natural states of existence. Those are not emotions. And when the body is...
It's natural for me to feel good and happy and joyful?
That's correct. That is correct. That is natural. Any other states, however, are unnatural, and those are what we call emotions. Yeah. So depression, anger, jealousy, resentment, all of those things are emotions. And they come usually because the person does not have a clear understanding of who they are relative to the experience. Yes.
Okay. And so these can be cleared up. We can actually learn how to move through this and make a shift in our lives by joining that Immortal Chat Club.
Oh, yeah, no question, because the bottom line is that when you change the definition of who you are, then your body chemistry changes and the cells will change. The memory will be canceled out depending upon the definition of who you say you are. So that is why in the Immortal Chat Club, these are people who have agreed that they are living manifestations of God, okay? We know for a fact that, the definition of human means that these are individuals who see themselves as having frailties, who are admitting that they are not responsible for the experiences that they have in totality and are really kind of like learning their way through life. A person who recognizes that they are pure consciousness, and we all are, that we are actually made in the likeness and the image of God, and that is anything that you see. A bee is in the image of God, a tree, a leaf, and also you. Then you are willing to say that because I am part of this supreme consciousness, I accept that in all areas of my life, and I use that awareness of myself to be able to create the quality of life that I need. So you have to understand that these immortal genes that we have require a high frequency, a specific chemistry to be activated. And the more you think about yourself, the better you think about yourself, the loftier definition you have about yourself, that is a quality of chemistry that now can begin to open up and activate the immortal genes. People who basically just feel that you're just getting along in life, we're just trying to make it, things are so hard, I'm such a victim, I'm so afraid, I'm da-da-da-da-da. That quality of chemistry will never be able to activate the immortal genes, because part of the law on this planet is really true, that the best survive. But best is what? Determined by you, not by anybody outside of you, not by any necessarily accomplishments you've made, but by you. And when you say that you're the best and you think of yourself as the best in all things, that chemistry then will activate the immortal genes. Well, how do we know that? Well, can you imagine that a turtle, a loggerhead turtle whose brain is about the size of a tablespoon, can live 350 years and blink its eye at you and not have a question about that.
Apparently they know something.
Exactly. They know that that is natural for them and that they are obviously undaunted by the unknown. They're not fearful animals. So to be able to come out of an egg and immediately jump into an ocean, do you know how vast the ocean is? And to be able to navigate that for hundreds of years is incredible. Here we are as humans. We've got to have houses and cars and clothes and all these things to think that we're okay. This is a person who goes into, this is an entity that goes into a space every day. It's constantly changing. It has all kind of animals in it and everything that we don't know, and masters that for 300 years.
Wow.
And they only have a tablespoon full of brains. Now, here you have a head full of brains, okay, but yet still you have reluctancies to be able to go outside your door. There's a problem here, and no, nature is not going to support that kind of perception.
Oh, my goodness. Well, you know, Dr. Jewel, the phone lines have just filled up. I'd like to go on and pause so we can take some questions here. I know that people have lots of questions. You've put out such wonderful information here. But I'd like to let everyone know to call in at 347-843-4485. And if you would like to ask a question, and if you're not just listening, to get your question answered, press the number 1. Press 1 and you'll be moved up into the queue, and I will see that you're interested in asking a question. So we'll go ahead and take our first caller here. I see a fish moon here.
Hello. Wow.
I'm not sure what happened there. Fish moon must be in a very noisy area. We'll go on to the next caller.
All right.
Caller in the 610 area code. Welcome to Solutions. Do you have a question?
No, I'm just listening. I'm Fish
Oh, you're
Moon.
just listening.
I'm sorry about that static.
Oh, okay.
Right.
Well, thanks for joining us. Enjoy the show.
My pleasure.
Let's see. We have a caller in the 334 area code. Do you have a question or comment?
I do have a comment.
Wonderful.
My name is Queen Goddess Yorkis Ra.
Hello, Queen.
Interesting
Welcome
show.
to Solutions.
Dr. Pookrum. Can you all hear?
Yes, we can hear you just fine.
Can you hear me?
Yes, we can hear you. Go right ahead.
Okay. And I have a comment, and I was sitting down. I wasn't expecting to find you on the on Blog Talk tonight. I was surfing, and you came up, and I'm still awaiting a phone call from you. But I was sitting here clipping some, going through magazines, doing like a vision board. And I found very interesting that as I was clipping, because the magazines that I have are primarily words I was looking at opposed to pictures. And it was very interesting because a lot of things you were saying, I was seeing phrases that either said the same word pattern and or were expressing some of the things that you were saying. And I just wanted to say that.
Oh, well, thank you, Queen. That's very exciting. That's interesting.
Well, what is that? What does that show? That actually shows that obviously we're on the same frequency. There's a phenomenon known as morphic resonance. Okay, morphic means like body, and resonance means to move. And so this is the same phenomenon that happens in schools, like, for example, schools of fish. And so when they are all on the same frequency, even though they're not touching, they all have their same space, they still know to turn right or left or to rise or to fall simultaneously. And so that's literally what she's experiencing.
Most definitely. And I have to comment that I've had the exact same thing since I've come into contact with you. The same thing, looking up the same phrases. I think on a show you mentioned that you looked up the word education and its root. And I had done the same thing the same previous day. So it is so very real. There's just one of us here. I'll go on to the next caller. Thank you so much, Queen, for calling in. That was a wonderful observation.
Thank you, Queen.
Let's see. Welcome to Solutions. Caller in the 585 area code. Do you have a question or comment?
I think I have a comment and a question.
Yeah.
Dr. Pookrum. My name is Hugh Chambers, and peace to you, Dr. Pookrum, and everybody on the program.
Yeah.
I've been suffering with asthma for 10 years, and I refuse to believe that it cannot be cured. And after receiving some of your DVDs and listening to your speeches, I feel more so that my asthma can be cured. And I'm wondering if there is any way I can get a number or website to be able to talk to you to find out the approaches that needed to be taken to get rid of this asthma. Because I don't believe I have asthma. Asthma has me. Because if I had asthma, I wouldn't be suffering.
Okay.
Right. Well, okay. You can always reach me at Jewel, Jewel, at drjewel.com. And you can then request a consultation with me, and we'd be more than glad to support you. I will say this, though. Just contemplate this. Lungs are controlled as far as attitude goes with perceptions of the joy in life or sadness and depression of life. I have never witnessed anyone with lung disorders that did not have a period in their life or are constantly battling emotions of sadness and depression. They automatically debilitate the lungs. So the just general attitude transformation that is very necessary for lung health is that you are excited about your life and that you pay attention to how you breathe, because you have to understand that when you inhale, when you take in air, you are actually taking in oxygen, but a lot of other elements, known and unknown, that are responsible for allowing you to have another day to live, another moment to live. And if you are excited about that, because that means that whatever you've experienced, you can change it. Whatever you want to experience, you can create it, which means that your breath is extremely important because it is the opportunity to allow you to experience heaven on earth. And so many of us take for granted our breathing. You know, we really do not understand how important it is for all of us as human entities on this planet to come together and demand that we have clean air, that we have better air, because every breath is an opportunity for us to have whatever we dream of on this planet. The breath is extremely important. So I really ask you to look at that. I can just confirm for you because I had an opportunity to heal myself of lung cancer. And when I finally had to diagnose myself because my professional colleagues, they missed the diagnosis. And so when I finally had to diagnose myself, my doctors had missed it. I recognized when I had to face the fact that I had created inadvertently something that was literally going to take my life if I didn't address it, I had to look back at my past. And I recognized that I had a lot of trepidation, that I had a lot of sadness in my life, and this literally had affected the health of my lungs. So I had to redefine my life. Was it worth me living for? And if so, what did I want to live for? What was my purpose in life? So when people are not driven by a purpose, when they do not have something that they look forward to, that they want to achieve, that also can weaken lung health. So once I decided that I wanted to actually live because I really wanted to leave a legacy for my children, but also for the planet. I really love people. I really do. I really like people. And even though I've seen some horrendous things that we have done to each other, there's just this core goodness and this core divinity that I have seen in so many people that, you know, I can see them one day looking one way and the next day, I mean, they're like magical. And so I just don't give up on humanity. And so, therefore, I recognize that one of the things that would take the pressure off of us is that if we knew that we had time to have it our way, to basically make the life for ourselves that we want. And I declared that I wanted to prove that disease and dying were all diseases, and that neither one of them was a natural course for your life. And every day I live, I see more and more and more and more proof of that. We can live for thousands of years, and perhaps maybe now that has just, blown you out of the room. So I'm just trying to basically get people comfortable with the fact that they can live 200 years, and we can live in a high-quality way. There's an example here. Someone sent me an article about this centenarian. Incredible gentleman, but he didn't learn one thing, and we all have to learn this, is that as manifestations of an awesome force, if you don't want to think of it as God, whatever, but it is awesome, you can manage to be able to take care of yourself all of your life, whether that's for 50 years, whether that's for 200 years. And this centenarian, 107 years old, does not have enough money to take care of himself. So the article was about having to create a fundraiser for him because he's 107 years old and he doesn't have enough money to pay for his standard of living. And I said, now, see, this is very important because being a person who is very interested in moving humanity into understanding that being 200 years old should be like you're 65.
Yes.
But we have to understand then that you are responsible for creating the quality of your life, all of your life, which means then that there's certain things that we cannot withhold from each other, which is the truth, basic education where everybody can read and write, where everybody is an expert to the extent that they can express themselves completely, that they are able to develop a skill or talent that they like and that they can exchange for whatever medium is available to them to get what they want. And so as long as you do not see me as worthy of giving me and supporting me and having the basics or vice versa, then you actually deprive yourself. Because maybe you were this gentleman and may be him, that you're 150 years old, but because you were not given full benefit of understanding that you can provide everything for yourself, okay? It has nothing to do with politics. It has nothing to do with the government. It has something to do with the way that you think. And it's important to understand that, government and all of these other structures that we create have their place, but they are not the determining factor as far as the quality of your life if you do not give that over to them. And that is what's very important here. It's like your lawnmower. I mean, the lawnmower does what you say. And, yes, it is responsible for making sure that your grass and the outside of your house looks a certain way, but you do not allow the lawnmower to determine whether you're going to be happy or sad or whatever else, et cetera. And that's how we have to handle our governmental bodies. This is very important. You created that. You bought the lawnmower. You vote for the government officials, and they don't determine that for you. You determine it for yourself. But this is what's important. How do you understand? I'm not interested in supporting everybody to become 200 years old and then have to wind up on federal assistance because they're 200 years old. That's ridiculous. So part of teaching you how to activate your immortal genes also requires you to recognize that you have this fabulous brain that if you use it constructively, you can have whatever life you want. There's no reason why everybody at 200 years old can't be multimillionaires. I figure at 200 years old, you should be able to figure that out, how to do that.
Okay? Definitely.
So I'm just saying here that, we're not going to talk about lengthening our lives and still being victims here. No, we're not going to do that.
Right. That doesn't work.
This is part of a whole overhaul of your consciousness to see yourself differently and to know that you can have it your way. And, I'm going to be quiet here, but I just really want the audience to get really clear about that if you can take an organ from a dead person, supposedly dead, and put it into someone that is ill, not healthy, but ill, and that organ works, what does that tell you about your tissues? Mm-hmm. It tells you that attitude is everything, because even this person who's ill, he is still wanting to live, and with just a little support, that organ will work for him, and it's not even his.
Isn't that something? That's really something to think about.
And it was declared dead. That's the whole point. So therefore, if you got all your organs, et cetera, do you think that your body does not want to renew itself where you don't age? Of course it does. And it's built to do that. You know that. You scratch yourself and see what happens. In a week's time, you don't even know where you scratch yourself if you're healthy. So that shows you that your body renews itself on a continuous basis. So where does aging come from? And that's a whole science, but it originates in your mind.
Definitely, most definitely. Well, you know, Dr. Jewel, the time has just flown by. We now have 7 minutes remaining. And I would so love for you to share your contact information. I'm hoping that the young woman will be able to listen to the show, or if anybody out there knows young woman, I think Just D was her name, to contact her and let her know that she needs to speak with Dr. Jewel, and she can actually get some healing, you know, on her emotional level as well as the physical. So please.
Well, let me just say, yes. Well, let me just say this again. You know, I've worked very diligently in studying for the last 25 years, and like I said, the conclusion is that we know that we have immortal genes. We know that the tissues will heal themselves when the attitude supports that. We know that people basically can literally come back from, quote, the dead if they so choose to, and resume their life. I mean, you know, all the near-death experiences and people in comas for years and whatever else. So everything points to the fact that, you know, this misnomer that we're to age and we're to die here is really, you know, quite tattered at this point. And it's only because of just habit and addiction that people still want to think that way. So we are now moving to a new era and a new capability that has to be taught. And that is what my Immortal Chat is about. The Immortal Chat Club is a group of us who basically discuss the tenets for laying down and activating the immortal genes. And so we look at what the mind really is. Most people have PhDs and they can't intelligently tell you what their mind is versus their emotions versus their brain versus their spirit versus their soul. So we recognize that the anatomy and physiology and the biochemistry of your body has not been taught to you in your normal environment. And if you're going to have control over your life and you're going to live in this vehicle known as a body, you must know and learn how it works. So we first of all begin to discuss and teach how this body works. Then we begin to talk about the more subtle aspects of your anatomy, your emotional body, the mental body, the mind, body, brain relationship. And because you are living God, you can understand the body just like I can. These words that were introduced to me when I went to med school are no different than them being introduced to you. You know, this is part of the folly, too, is that, you know, people have such low perceptions of themselves that they think that, you know, oh, you can't give me the big word or give me the Latin definition of it. Why not? Anybody who went to med school was just like you. So why did we be able to handle these words and to have this understanding? First of all, because we wanted to, and secondly, because we exposed ourselves to it and we opened our mind to it. So I don't ever want you to ever think that learning about yourself is too complicated. Trust me, you want to learn about yourself because I'm telling you to die and then having to recognize that this was something that was not even necessary is quite embarrassing. It's quite embarrassing.
So.
Right.
It's
so
like
therefore,
having,
right.
it's like having a tool and not knowing how to utilize it. It's like, okay.
And very much so, very much so. And it's like, you know, that was like really stupid. I mean, you know, I had everything and I didn't even recognize it because of a belief system. Come on, and we're going to look at that. Yeah.
As our minutes are ticking away, please share your information how people can contact you and how they can get involved with this powerful Immortal Chat Club.
You can go to my website. That's drjewel.com, www.drjewel.com, okay? And you can either write me at jewel@drjewel.com, and doctor is spelled out, D-O-C-T-O-R. It's a full word, not abbreviated. And also, you know, as I said, this is our 5th chat. We've just started. We do have a mechanism to make sure that you understand you can come in at any time, become a member. You can get the archives so you can study to bring yourself up to date, because this is a constantly progressive chat club, etc. And know that we are there for you. So, if there's any problems, technical difficulties, because, running a chat like this, we have quite a few members. It's been amazing to look at the technical difficulties, but we're working them out and just hanging there with us, Yeah, so I'm just excited. And Tamara, just thank you so much for allowing me to share with the audience. And, if you never hear me again, et cetera, I want you to remember that you are fabulous, you are awesome, that you have the capacity to achieve anything you desire in your life, and never doubt that.
Oh,
love
thank you so much. Love you too, Dr. Jewel. Oh, we just love her.